Hello again, friends. It's me, Dr. Leah Torres, now known as Notorious LNT. Thank you, Live Action, for that. And today, folks, we're going to doc-splain some abortion laws. This is going to be really important, and I'm going to try and just tone it down so that we don't get too much in the nuances of the details. We'll parse this out, but here's the thing. Abortion is medicine. It's a medical procedure. That is as disputable as the earth revolving around the sun. Okay? You can believe what you'd like, but the fact of the matter is that abortion is medical care. It is health care. So, period, the end. No more discussion, no more debate. It's just not debatable. By the by, I have my chai tea in my Wonder Woman changing color mug, which is super fabulous, and I love it so much. So, good stuff. Something's happening in Missouri. It's hard for me to keep track about all of the human rights violations that are happening across our nation, and that seem to be fine, and no one's kind of stopping what they're doing and questioning the orders that they're given and blah blah blah. Like, children are in cages and they're not being given medical attention, and people are being held against their will in what by definition are concentration camps. And people are denied health care and being denied health care through political actions that have nothing to do with medical practice and absolutely nothing to do with patient safety, by the by. Negating patient safety. In other words, causing people harm. What do I mean? Well, there was a case in Missouri, and I don't know the details. All I know is an abortion procedure was done. It went awry. Someone was taken to the hospital. They're blaming the doctors because abortion, right? From my superficial understanding, there are regulations that exist in Missouri that do not allow doctors to perform abortions in the safest place possible. So, in essence, the laws have created an unsafe environment for people to have abortion care. And somehow the doctors are to blame for no, the doctors are not to blame for that. Legislators are passing laws that are ignoring medical safety, medical guidelines, expert opinions. The legislators in Alabama, in Louisiana, in Georgia, in Missouri, and I'm sure, has been in Utah, are ignoring experts when we say, this is dangerous, people are going to get hurt, please do not put this law into effect. We are being ignored. Public safety is threatened by the people in office that were voted in, and we need to vote them out. They are a public safety hazard. Let me break this down in a very straightforward, what I think is a straightforward example. I had a patient in Utah. This was years ago. And I will use this patient's case as an example of how what seemingly harmless, no big deal law can turn into a deadly scenario for patients. Utah has a law that says no state funds can be used for abortion provision. What that means is essentially any hospital that might receive state funding cannot use those funds in providing abortion care. So, broken down means 1, all of the hospitals in Utah receive state funding. 2, 0 of them separate state funds from other sources of revenue. So all the money is mixed together, so there's no way to know if this dollar came from the state and this dollar came from an insurance company. That there's no way to know that. So you have a scenario where you cannot provide abortion care in hospitals in Utah, parentheses with their exceptions for rape and life of the mother and other nonsense, arbitrary exceptions, end parentheses. You cannot provide abortion care in hospitals in Utah because they don't separate out the funds, whether it comes from state or somewhere else, and therefore you don't know if the IV tubing that you're using or the needle that you're using to give the medicine or the speculum that was sterilized in the hospital, you don't know if any of that was paid for by state funds. So therefore, no state funds can be used for abortion care turns into no abortions can be performed in any hospitals in the state. No one thinks about that except the abortion providers. We know how dangerous that is. We know how dangerous it is for a politician to make the decision about where I should be performing medical procedures. That is a dangerous scenario. In what world do we live in where a non-medical person tells a healthcare provider where they can or cannot perform X or Y procedure? This only happens in abortion care. No other area of medicine has this happen. So what does that mean? That means if someone, like my patient, comes in and she is 6 weeks pregnant and she has a bleeding disorder and she wants an abortion because she's pregnant and she doesn't want to be, and that is the medical reason, that is the medical indication for having an abortion. She is pregnant and doesn't want to be. In this case, carrying her pregnancy to term is far more dangerous than having a first trimester abortion procedure. Now she's 6 weeks with a bleeding disorder. In theory, she's eligible for a medication abortion, but I don't want my patient at home bleeding because we've induced what is the same as a miscarriage, and she has a bleeding disorder. That's not a controlled scenario. That is not safe. And so that option is actually not an option for her. I often find it very safe to perform a 6-week surgical D&C in an outpatient setting in the office with sedation, without sedation, with local anesthesia, that sort of thing. It's very safe as an outpatient procedure in an office setting. We do this all over the country for miscarriages that are also not, that are not regulated in this way. So we're doing it for miscarriages. We can also do it for termination. But you see, she's got this bleeding disorder. And so it's not safe to be in an office setting without blood products on standby, without specific medications that generally hospitals carry and you don't have in an office setting, without the special equipment and staff you might need. Extra staffing is important. These are factors that are important for patient safety, and these are taken away from the doctor-patient relationship in providing this medical care in this specific area of medicine because legislators decided to pass laws that they don't understand the implications of. So what happens? Well, we can risk doing the procedure in the office, which in Utah is actually meets the requirements of a surgical center. Another unnecessary regulation, but we're not talking about that right now. We're talking about the state funding cannot be used for abortion care regulation. We can take our chances in the office. She can continue her unwanted pregnancy against her will and be forced to have a very increased risk of death during her third trimester and delivery. Or she can go to an entirely different state to have the abortion procedure, which is going to cost time, putting her farther along in pregnancy. It's going to cost more money because procedures get more expensive, especially if you don't have insurance coverage the further along you are. She's going to have to take time off work. She's going to have to get childcare for her other children. These are all things that prohibit her from getting timely, safe medical attention. And I am done with these laws putting my patients in danger because of feelings. If you didn't go to medical school and you didn't go through training and you didn't get licensed in medicine, you don't get to practice medicine. You don't get to provide health care. This is not to say that healthcare regulations aren't necessary. They are. But stop discriminating. If you're going to regulate abortion clinics, regulate dental clinics the same way. Regulate plastic surgery centers the same way. Make it equal. That's fine. But don't target reproductive health care because women and people with uteruses are not expendable commodities. We are not broodmares. We are not expendable. We matter. We are valuable. And we need to stop believing the lie that pregnancy is just something we do. We decide if we stay pregnant once we are pregnant. Only we decide. And if that means that my patient comes to me and I say, you know what, this pregnancy could kill you, and she says that's okay, that's my patient's decision. If she understands that continuing her pregnancy may cost her her life, that is her decision. If I have a patient in labor and I'm watching her baby crash and I tell her, we need to do a C-section right now or your baby's going to die, and she says, I refuse a C-section. If my baby dies, that's what it is meant to be. I cannot force her to do a C-section. But the minute you put fetuses as being more valuable and worthy of more protection than the person who's pregnant with them, the minute you do that, that means I forced that person to undergo major abdominal surgery against her will. I am not okay with that. And so any of these laws that do not have a specific medical purpose, that do not promote medical safety and patient safety according to guidelines that exist currently, which are based on current research and medical evidence, then they should not be put into law. Especially not by people who have no understanding, no training, no licensure in healthcare provision. I need some more chai tea. It is madness that this is happening. And it's getting worse. So all these heartbeat bills, and all of that falls under the same umbrella of dangerous politics that basically are a big neon sign that says, we don't care about people, and we don't care about families, and we certainly don't care about human rights. We are okay violating them. People can only do what we tell them to do with their bodies. And you think it's going to stop with pregnancy? That's not where it stops, it's where it starts. We have to do something. If that means donating to local orgs that are on the front lines dealing with these horrific laws, trying to get people the safe care that they need and deserve, then please donate what you can to these organizations. If that means volunteering, please do. If that means calling your legislator every day and telling them how dangerous they are being with their whatever proposed bill or whatever is coming through, then please do that. Call the governor. We are their bosses. They answer to us. We've forgotten that. We have bought into the lie that legislators are these powerful beings. No, they answer to us. And we have to hold them responsible to what we need and what we deserve. They don't get to impose their own beliefs. Sure, they're guided by their own principles and their own experiences. But if you have all of your constituents telling you, do not pass this law, you better not pass that law. That is our democracy, and our democracy is being eroded. We need to wake up and we need to use the power that our founding fathers gave us, which is our voice and our vote. And it's work. It is. It's work. I get that. But if you value anyone with a uterus, anyone who could possibly get pregnant, this is what we need to do. I value all human beings equally. It breaks my heart that our legislators don't. I think I have to stop ranting now. My blood pressure is certainly elevated today. So I leave you with that. Go forth in love, be compassionate. I will see you next time.